Good evening, members, and good evening to members of the public who may be watching online. Welcome to this BCP Overview and Scrutiny meeting. Before we start, I'll ask our Democratic Services Officer if she would read out the housekeeping notices. Thank you.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in front of the building. And finally, please could everyone ensure that background noise is kept to a minimum and mobile phones and other devices are turned off or switched to a silent setting for the duration of the meeting. For those in the room, this includes turning off microphones and turning the volume down completely on laptops. Thank you.
Thank you, Claire. So agenda item 1, apologies. I believe we have apologies from Council Board Head. And agenda item 2, we have substitute members. I do not believe we have any substitute members this evening.
That's correct, Chair.
Thank you. Agenda item 3, declarations of interest. Members, do any members have any declarations of interest? No, we don't. Okay, thank you. Agenda item 4, confirmation of minutes and for an action sheet. First of all, deal with the minutes of the last meeting held on the 23rd of September and also the meeting held on the 1st of October. Does anybody have any comments on those minutes? Okay, we'll take those as read then. Thank you. So we will quickly go through the action sheet. If I can find it. Okay, so we've got access to the action sheet. There are a number of items on here that have been drawn out of the discussions at the meeting. What I would like to do is to keep this action sheet much more specific to specific actions agreed at the meeting that we really need to discuss at the next meeting. At the moment, there are a few fairly general ones in here. I'd like to go through them and make some suggestions about what we do with them and if you're in agreement or otherwise. Okay, so we will go through each one. So minute number on the 27th of August, minute number 28, council budget monitoring 24-25 at Q1. That will be on the agenda and I can't remember which meeting it is on, but we will be taking that and we will be doing that routinely actually because it's one of the main functions of this committee. So I think with your agreement, I'll take this off. It will be on the agenda as appropriate. 29, shared vision for Bournemouth, Christchurch and Paul overview of scrutiny, utilisation of the performance dashboard. You remember we had quite a long discussion. We saw the draft of the first performance dashboard and that will be used in a number of different ways. And we did undertake to circulate quarterly performance monitoring reports as information items on the agendas, which we will be doing as and when we start to receive them. So that would be taken as a read that we will be doing that. I don't think we need to leave this on here. We note that and it will be done. 29, the board will take account of the dashboard when undertaking annual work planning activity. Well, again, you know, I think that's something that we will certainly be doing. I don't think we need to leave it on there until we do, you know, once a year. So I think again we can note that and remove it from this list. The next one, officers be requested to work with all ONS committees to implement similar arrangements as those agreed by the board in order to utilise the dashboard across the function to drive evidence-led scrutiny. Well, again, you know, we will be issuing that dashboard and it will be going to the other committees anyway. So again, I don't think we need to keep that piece. And of course, we would expect officers will be working alongside those committees anyway. So again, I think we can take that off. 29, the performance team would feed back to the relevant service areas the issues raised by the board. Well, I think we're going to do that anyway, aren't we? You know, the officers, in fact, will be at the meeting when we actually review that particular performance dashboard. So we would do that anyway. 29, shared vision for Bournemouth to get leader of the council to follow up on the issues raised regarding homelessness performance from the dashboard. it was something that the leader said she would do. I think we'll just leave that one on there because she said she would do it, and I've not had a feedback from her, so I think that one's fair enough. Progress update on the best value notice, a copy of the members' officer relations report to be circulated to board members. Has that been done, Claire? Do you know?
I don't believe it has.
I've certainly received a copy of it. This was a report that came out of the best value notice that wanted to give more detail about officer and member relations, and it was sort of titled a member-led council. I have seen a copy of it. I think you all need to read it. It doesn't replace what's in the constitution. It adds a little bit more fat to it. It's sort of a more friendly sort of way, just to expand on that particular subject. I found it quite useful when I read it. Claire.
May I ask you to clarify that, Steve? Because I understand report to be something, you know, describing sort of the state of affairs, but then you said it's going to sit on top of the constitution like it's prescribing behaviour. So how exactly is it to be understood?
I'm not sure how you understand it. All I can do is make sure you get a copy of it because it has been produced and you can make your own mind up. But the action is to make sure everybody's got a copy of it. So we will do that, and we'll leave that on there until that happens. Okay, meeting on the 1st of October, ONS Budget Working Group Scoping Report. That working group be established to look at the topic areas of car park and residence card. We have set up the working groups and the arrangements for those are being formulated, and I think some dates have been suggested. So that action has now been accomplished, so we can take that one off. The last one is the forward plan to follow up on the issue raised regarding online reporting with the relevant director. I haven't spoken to Matty about this one yet, but it's something that we'll all be discussing, I think, when we come to the forward plan, because I think there may be a suggestion that we set up a working group to look at this one. And I know it was an issue that was raised at the Audit and Governance meeting this week or last Thursday, I think it was. So we'll discuss that later. So that one can stay on there until such times as we decide what we're going to do. Which then I think concludes agenda item 4. Agenda item 5, public issues. Do we have any public issues?
No public items have been received, Chair.
No? Okay, so that brings us to agenda item 6, which is the Blue Badge Service Update Report. Now, members, if you weren't here at the time, we did some members of our board did do an informal investigation into Blue Badge, the Blue Badge system, because there was anecdotal sort of evidence that we were not performing particularly well from residents on that area, and in fact, it was Councillor Sam and myself and Councillor Trent. We looked at this. And we came up with a report which was considered, I say, about a year ago. We do make some recommendations in it, and we thought at the time it would be useful to bring it back to the board in about 12 months' time to see what progress had been made on those recommendations that we made. And we've now received the report. Thank you very much for producing it on time. I really appreciate that. It's great. So I will call upon the portfolio holder, Councillor Andy Martin, to introduce the report to us. Thank you.
Yes, thank you very much, Chairman, and thank you for the opportunity to say a few words before your committee hears from Matty and from Stuart with regard to some positive updates from your action plan last year, for your proposals last year. And in fact, although this report was only supposed to be about the update from last year, your members will note that there's some additional information in there regarding the demand on the service, where we are with the waiting time, and I'll come back to that in a minute. So it is an opportunity for us to say where we are now, rather than just what progress has been made on your request for action points. So let me say at the outset that clearly we're not where we would want to be in terms of waiting times at the minute. and I think we can say that we are we understand why people are frustrated and to a degree perplexed by the length of time it's taken to get some applications processed. So my focus on the Blue Badge service has been heightened in the last few weeks, partly because of the increase in the time, but also because I've had several people approach me, both in my own ward, and we have for those of you who are familiar with Highcliffe, because I don't mention Highcliffe very often, obviously, will know that we have a very high number of elderly people in that ward, and also, but not just people in Highcliffe and Watford, but actually people who've contacted me in my role as portfolio holder for customer services. One resident is registered blind that's contacted me, and another is the husband of a lady with stage 4 cancer. And I am pleased to say that both these cases were dealt with quite speedily after they had got in contact with me. I actually wanted to, it's a point I'll come back to in a minute, but I wanted to share with you a couple of lines from one of the emails I received from one of those people, because I think it speaks to the issue of how important the blue badges are, but also to the issue of the bureaucracy around the blue badge system more generally. And let's not forget, this is a national scheme through gov.uk. So this resident wrote to me and said, and I quote, I appreciate that some form of assessment is necessary, but I do not understand why I need to be assessed each time, as I am blind and will never be otherwise. Sorry to bang on, but the blue badge is important to me and makes life a lot less complicated. I am so frustrated about what I see as an inefficient and prolonged process. Now, the process that we go through, or the team goes through, is not all parts of that process are not in the control of the council, and I think we'll all appreciate that. Bottom line is, of course, that we're at 14 weeks at the minute, and I know Matty and Stuart will address that, and we can all agree, I'm sure, that's not not where we want to be. A little bit of context about the pressure that all services are under, not just the Blue Badge team. So the wider customer services team and budget is under pressure, and one of the things we've talked about is potentially taking staff from other parts of the customer service team to work on Blue Badge. And I'm sure, again, Stuart and Matty will address that, but there would be consequences for that as well, especially when people in those are helping people in those areas with things like revenue and revs and bends and housing. People are equally needing our help and our service. Before we get into the detail of the update, I just want to say that personally, I think the Blue Badge system is not fit for purpose nationally. It needs an overhaul. It's cumbersome, it's bureaucratic, as I mentioned earlier on, and as you all know, it's not, all parts of this process are not in our control. The £10 fee, I mean, Chairman, we talked about this briefly last week. The £10 fee is, in my view, ridiculous. It's way too low given the cost of the service and given how valuable the Blue Badge is to those who have it. And I think that's something that really needs looking at. And I do not understand why national government appear to be reluctant to put that up to a more realistic level. I'm not talking, I'm talking £20, £25, £30. And that is something I think our MPs really need to take up on our behalf as well. And I think the other thing is to note that people are living longer, there's increased demand, increased pressure on the system, and there's also clearly a case for lifelong Blue Badge applications for individuals with lifelong diagnoses. I don't understand why that part of the system cannot be streamlined as a national thing. I have just to note, I have asked the team to look at some benchmarking to see how other areas are performing, what resources they put into the system, and I know that will be addressed. And hopefully we'll get some feedback. That's a bit of a longer term thing, but we are looking at that. I think that's all I wanted to say, but obviously happy to answer any questions as we go through this evening. But perhaps just pass over to Matty and Stuart for now. Thank you, Chair.
Thank you, Councillor Martin. Chair. Good evening, members. I'm joined by Stuart Walters online, who's the Customer Services Manager, who has a closer understanding of the Blue Badge service. But hopefully between the two of us, we'll be able to answer your questions. But I was going to start by just referring to the report and just picking out some of the headlines, really. So just by way of setting that context, we have just short of 21,000 blue badges on issue within the BCP council area, and we deal with probably something in the region of 950 applications every month. So you can get a feel for the kind of volumes of work we're receiving. We have a relatively small group of staff that are dealing with the assessment activity. That's the part that is ensuring we're meeting the DFT guidelines in relation to eligibility from applicants. And that's about just over 3 full-time equivalent staff. It's difficult, Councillor Martin mentioned about benchmarking. It's quite difficult to benchmark without quite a lot of kind of additional working with other authorities, because other authorities will have different demand, they'll have different resources, they may operate elements of the process slightly differently to us, although essentially the process is one that the DFT prescribe to us. If I can start just by touching on the actions from last year and then come back to the performance issues themselves, I thought that might be a useful way, because as you said, Chair, the original intent of the report was to update you on the actions that the informal group identified, which were helpful to us in working with members on understanding how the process works. So just to begin with, in terms of a renewal reminder, which is on the second page of the report, that is enabled within the online process. The online process is one that goes through gov.uk, and then when people make their application, it comes into our own system in the council. Some applicants do use a paper process, and they'll take them into one of our customer services hubs, and then that will be then input into the system. But in terms of the renewal reminder, that can only happen through the official DFT kind of led system. If we were to try and do the renewal reminders for the paper-based applications, there's a degree of work and there's a tension here between trying to do that and then diverting staff away from processing to do those reminders, and the report refers to that. Paper applications are, as I say, in the minority anyway. Largely, whether people do it themselves or they get a member of their family to help them, they come in online. We are due to change our blue badge system in April 2025, and the likelihood is that we will incorporate it into our Microsoft Dynamics system, and at that time we'll be able to initiate reminders for everybody, whether they've done an online application or whether they've done a paper application. So hopefully that reassures members that we are working towards everybody getting a timely reminder, because we realise after 3 years, and most of the blue badges are in place for 3 years, it's easy to forget when you applied, and if you don't get a reminder, then you miss that opportunity. And if the lead-in time is fairly significant, then if you're a few weeks out, then you could be at risk of not having a blue badge when you need it. Secondly, there was a recommendation around ticking a carer's tick box on the application form. Unfortunately, as we don't design it, it's an application form that has to be agreed at national level. This has been ruled out when the original application was designed as being not necessarily adding a great deal of value. Now, I think in relation to members' views on this area, it was really kind of about ensuring that where an application could be verified with additional information that is in the possession of the council, then we would know that was that individual applicant had a connection to our services, and then we could avoid asking them for information that we already had. And that's exactly, fair enough, a very sensible suggestion, and we do it in relation to some other information, particularly around revs and bends verification information. What we weren't able to do until pretty much this week, was to interrogate directly our adult social care systems. Obviously, there will be applicants, probably a significant number of applicants that are applying that are known to us via adult social care services, and they'll be in a system, but clearly we don't just share information without going through a scrutiny process to ensure that is all acceptable. We've been in contact with adult social care recently, and they've confirmed this week that customer services staff who do the blue badge system can have access to the adult social care system, which means that whilst we won't have a tick box to say I'm known to adult social care, which would be kind of helpful, we can't have that. But what the staff will be able to do is by their interrogation of the application, they'll probably get a fairly good idea whether somebody is likely to be a client of adult social care, and therefore they just be able to go straight into the system and probably very quickly get the verification that they need. Whereas at the moment, what happens is we have to email adult social care. We might have to wait a few days, depends on workloads and so on. We might then get something back. We need to ask a few further questions. So direct access into the adult social care system, I think, is really helpful. I don't think it will necessarily change the world in terms of our speed, but it will cut down some of the delay that gets built into this 12-week timescale. In relation to fees, Councillor Martin's touched on this already, and the report highlights the relative costs. We have done a little bit of cost recovery analysis on this, and whilst there's probably more we could do in detail, we do believe it probably costs for every blue badge that we issue, it costs about £25 in terms of our costs. We don't issue a blue badge to every applicant. There are some that we refuse, although they are in the minority. So if you divided the cost by the total amount of applications, it would be a slightly less. But I think £25 is a useful kind of benchmark in your head in relation to what we think it costs us to manage this process. And you could argue that's the cost as it is now at a standard where we're really under pressure and not really delivering what we would like. If we were delivering it at a level we would be all, I'm sure, satisfied with, then there would be more cost in there, potentially more staff, more cost. Therefore, the cost per badge would be potentially higher. The report highlights that we have raised this at a national level, and I think the general concern is shared by many authorities. But of course, their relative resources for managing this service will all be different as well. So not everybody's starting from the same starting point. The members group identified the value of producing a flowchart, some way of better describing to customers how the process works, to ensure that they put enough time into going through that process and they don't leave themselves without a blue badge due to expiry. We have talked about this with our web team. There is one kind of hurdle, and that is when we put information on the website, we have to be conscious of customers that, particularly in this bracket, this kind of category of customer who might be using a screen reader, and so often when we put in information on the website, we have to think about how that would work with a screen reader, and clearly a flowchart won't necessarily work as you would expect it to, because it will read what's on the screen. That said, I think there are other ways of doing that, or doing both. So we could potentially have a flowchart and some associated wording that a screen reader would work with. So we've still got further work to do on that. So I think we might be able to do a little bit of both, but that's why that's still yet to be done. And there's also a great deal of web-based information that is still going through the process of being updated and harmonised following the bringing together of different the legacy website systems. In terms of why a note on why the process takes up to 12 weeks to process, we've added some additional information on there. I think there's also something on there at the moment about it taking longer than 12 weeks as it currently stands. So we do try and keep customers informed as best we can. But as I said earlier, I think when people are only applying every 3 years, it's very easy for people to get it, forget about it, and then get caught out perhaps at the last moment. Probably just need to stress that new applications and renewals are treated the same in terms of eligibility checking. In other words, whilst Councillor Martin has rightly kind of referred to perhaps the frustration that we keep asking people to verify themselves and their disabilities when they may have an obviously long-term or lifelong condition, we have to do that. And I think if I now move on to current performance, there's probably a link between what we've just said and current performance. Well, there is a link actually, and that was 3 years ago, where we were in a similar position in terms of pressure. This was post-COVID. Lots of people hadn't renewed their blue badges because they didn't need them at the time. So once they got a sense of the green light and we could start living normally again, we had suddenly an influx of applications. And to try and overcome that, I kind of worked with the team to look at, well, you know, new applications, yeah, we have to verify those. It's really important that we do that. But given the pressures at the time, I agreed with the team that they would do minimal eligibility checks on the renewals for obvious reasons, you know, including the ones that Councillor Martin's mentioned. So we put through a significant number of blue badge renewals at that time, and we hope that we could keep that approach. Unfortunately, we weren't able to keep that approach because it doesn't comply with the DFT guidelines for eligibility checking. So following an audit review, we were required to return to the previous system. Okay, you know, we did what we did, lesson learned. We couldn't necessarily keep doing it, even though it probably would be helpful to have something like that in place. But what it unfortunately meant was that 3 years later, we were going to suddenly get a big group of renewals coming up because we pushed through a lot of the renewals 3 years previously, and that's what we're experiencing right now. So the numbers we're currently receiving are quite significantly higher than we would normally be expecting on an annual basis, to the point that I think you can see in the table in section 6 that we're getting this year from April to October compared to the previous similar period, 48% increase in renewals. And we're also getting an increase in new applications as well, and that probably also, you know, links to people living longer but not necessarily living longer in good health, and therefore we might expect that more people would need mobility support as well. But the key one there is on the renewals, and that's probably a reflection of what happened 3 years ago when we moved them through quite quickly. The report also refers to a degree of sickness absence within the team, with the team leader position. I think it's just in recognition of relatively few resources in the team to do the assessment process. When you lose any amount of that capacity, it's going to have a little more of an impact than it might in a much larger team. We have now got an interim manager in the post who knows the service, who's also created a action plan for improvement. And it's probably important to say that that's where we can improve. I think given the system is largely dictated by the DFT process, there are only parts of it that we can nudge and change, and we hope that collectively they begin to have an impact on the speed at which we're able to process the applications. But fundamentally, you know, we're still going to be probably in our current performance level for a while longer, whilst we work through the issues that I've referred to improve the process and to see the benefits of that additional staffing capacity and leadership in the service. There is, as I say, an action plan attached to the report which highlights some of the things that are being done. The one about access to the adult surgical care system has now been agreed, so we'll be just training the staff on how they do that, and that will hopefully speed up the process. But in terms of getting back to within that 12-week timescale, which is obviously the aim. I think I would hope to think that in the new year we will be, making significant progress towards that. But realistically, getting back to a 6 to 8 week timetable, given the demand I've referred to, probably realistically is more within the next you know, 6 to 12 months probably. But if we can get back into below that 12-week timescale, then we're in a position that's very similar to many authorities around the country. Although, as I said earlier, you know, each authority approaches this with different levels of resource to begin with. I'll probably stop there, Chair, and I'm happy to take questions, and Stu's with me, and obviously Councillor Martin as well.
Thank you very much. So members, Councillor Trent, yeah.
Thank you, Chair. Oh, that's better. Yeah. Yeah. I must admit, I was very disappointed when we seemed to be improving the turnaround times, and it was actually part of the standard message on screen. In fact, that message stayed until September, where it said that, you know, it's the target is 8 weeks, we're achieving it within 9, and we'd already drifted. I do I do welcome the having the reminder system in place from next April. I think that will be very positive, because I think half of the problems are caused by people not reapplying in time. But the thing that caused problems, and I thank Matty for sorting it out, because it I had a case, and I was away on holiday back in June, and I had a case, and I sort of referred it on, and at the time I said, well, I think you'll get your answer within a couple of weeks. That was the message coming back, and then someone was off sick, and they contacted me again when it was over 12 weeks, and in fact I think it was probably dealt with about 13 weeks in. But I do think that we need to look at ways of having some people that are trained in multiple jobs, so that they can backfill these positions quicker. You know, I think this position was backfilled and things got sorted out. Otherwise, they were sort of drifting into really difficult sort of territory. And I know a couple of weeks ago when we were talking about the possibility of voluntary redundancies, another round of that, saying, for heaven's sakes, don't do it with front desk jobs. But I do also like the idea of being able to cross-reference to social services records, and I think that'll help a lot. And I do think that maybe not only lobbying on cost, but lobbying on not having to go through the full set of checks for a renewal. I think that all makes sense. So yeah, it was unfortunate that having seemed to have a very positive impression of what was going on, it all kind of fell apart. And I've heard lots of other members refer to it, and I think someone chatted to my wife about it, but it, you know, she said, oh, well, that's another area, you know, contact your local ward councillor. But that was someone who had been waiting 12 weeks and so on. So you know, I hope we can get it back on track. And but I do think that the one thing that we can do is, as I say, to find a way of having some people that are flexibly trained, so that if there is a long-term sickness, that someone can sort of move sideways into a position, so that we don't actually have the unfortunate sort of problems, the sticking point. So, but you know, thank you for sorting out the one particular issue I brought to your attention, because that was literally, there wasn't anyone in the job at the time doing it, so suddenly it just wasn't being processed. But it did get sorted, so you know, I had a happy customer in the end. So
Thank you, Councillor Trent. Is there anything that you wanted to come back on that? I think the issue that sort of a question there in that view of things was about cross training of staff. I think that was a point that was made. You might wish to come back on that. Thank you.
Yeah, thank you, Chair. We are doing cross training of staff. We have to kind of align which staff would be doing it, because there's different levels of customer services staff. But and I think Councillor Martin mentioned about potentially those staff that do revs and bends work, because it's a similar assessment kind of related activity. But the issue we face generally is that those other activities are also in demand. You know, we get an awful lot of calls around, you know, council tax and benefits inquiries. So I think we have to be a little bit careful that we're just not shifting a problem around. But I think it's an important point that where we can have staff that are multi-trained, we should do so. Generally, across customer services, we have to recognise that we deliver a very wide range of support for council services. So it just isn't practical for every customer service advisor to be knowledgeable enough across every service. If they tried, they would fail, and if they are not knowledgeable enough, then they're not really helping customers, because all they've got to do is escalate each call, because they can't possibly retain that level of information. But so we do them in groups of services. And just to reassure you, though, the Blue Badge team only do Blue Badge, so that's probably a reflection of the scale of the volume of the work and the complexities that are involved, and it takes a little while to train them as well.
Thank you. Councillor Devon, please.
Yes, thank you, Chairman. It's a question which is a very basic one, and I'm probably not understanding, but there's on your chart, Matty, action 1, appendix 1 action plan, you say in action, stop customers for having to reapply when they have completed the online form incorrectly and they are not automatically eligible, and it reduces the number of applications received and a reduction in rejection notifications. I simply just don't understand it. How do you stop them having to reapply if they've done it all wrong?
No, I think, and I'm sure Stu will put his hand up if I'm wrong on this. I think that means that when somebody has done an incorrect application at the moment, that results in a refusal, and then that results in them having to make another application. Whereas if it's a case that we can, it's not a completely ineligible application, it's one that we can help resolve, then they won't get a rejection, they'll just get advice on how to resolve that issue, and secondly, we don't then have to deal with another application and they go to the back of the queue. I think that's right, Stu, is that correct? Stu there?
Sorry. Yeah, good evening, members. Yes, Matty, that's exactly it. The current process was that if you applied under a certain heading, it didn't provide you with the necessary questions around your eligibility. And what would happen is that would get closed down and the applicant would then have to reapply and go through the whole process. And the team manager that's come in has taken a look at that and said, no, we're going to do that a different way, and we will go out rather than making them have to resubmit a whole application, and to just provide what we need for the new application criteria.
Chairman, can I just ask, not on that topic? So I think all of us have had a lot of people saying, where's my blue badge? And why is it so long? And I'm hoping that my information that I give out is correct, is that if you're taking too long to process them, they're still okay to use the badge they've got, even though it's out of date.
The answer is yes. We don't enforce on expired blue badges for up to 3 months after they expire. I think the reason we're hesitant to communicate that too widely is, but that relates to council car parks, and there's always a danger people only get half a message and then they park in a different place where a blue badge might normally be fine. Their blue badge is out of date and then they get a ticket. So but generally when people contact us and they say, look, it's about to expire, I'm about to lose my mobility and so on, then we do try and reassure them that won't be the case. But yeah, it comes with that caveat. It relates to council car parks and on-street car parking only.
Thank you. Councillor Savin, please.
Thank you. So as Leslie just said, yes, we are all getting a few more of these than usual, and it's obviously there's a good reason why. I had one last week, and the what I wanted to raise was around the way that you can apply, because this particular one that I had last week was an elderly person who was told, I believe she called, so she phoned customer services and was told that the only way to apply was online, and she's not online. She's applied via, a family member has done it on her behalf, but I obviously see in the report there's reference to a paper form, and therefore I'm sure that there is a paper way to do it, but there's something's gone awry there in terms of the advice being given, perhaps. I went online today, and I know obviously the resident wouldn't have done this, but I went onto the website today to see if I could find anything about other ways to apply, and there's nothing. There's not a like, if you're struggling to apply online, please call, or anything like that. So I'm just raising that about, again, this cohort of people are going to be often people who might struggle to, particularly our older residents who might not be online or might not have an internet connection, etc. So that just some clarification around that messaging, I think, because it's confusing some people, clearly.
Yeah, no, a point taken. We don't get huge numbers of paper applications. I think, as I said earlier, that I think either people do them online or they get help to do them online. But we recognise, and this is the same with lots of digital services, that we try and offer a kind of safety net for those that can't or won't or don't want to use online services for all sorts of different reasons. So they could go into a customer service centre and they could access a paper copy, and then that would get submitted, and then that would get put into the online system manually by staff behind the scenes.
So if I just, interestingly, because I did talk it through with this resident, and they specifically said that they'd asked if they could go into the customer services desk, which is what they'd done 3 years previously, and were told they couldn't. So there was some bad advice given, I think, and the person seemed very certain that that was the advice they were given. So yeah, just a little bit of feedback. Probably just, mistakes are made sometimes, aren't they? But yeah, that was that.
I'm happy to take that back to the team. Yeah.
Councillor Martin.
Yeah, thank you, Chair. This thing about digital versus paper is something I have raised, not necessarily in the context of the blue badge scheme, but I've raised it before in meetings, cabinet meetings, and actually in full council. Again, referring to my own ward, which has the oldest population in BCP. I am trying to remind everybody that actually some people are not comfortable or not able to use online, and I think it's something that we need to be constantly aware of. And I raise this because I had a meeting last week with the leader and the local representatives of the Citizens Advice, who, as you probably know, provide great services in our libraries. And the purpose of the meeting was about digital exclusion. So we have had an hour conversation about this whole issue about lots of people who don't want to or can't access online. And I know the chief exec is always telling us about a digital-led transformation, and I'm saying that sometimes we need to reflect about what we are doing in terms of people who don't want to be in that digital part of what we do. So as part of my takeaway from that meeting, working with Matty, I'm looking at all our services and what are our policies for people who are digitally excluded or just simply don't choose to be digitally excluded or through no fault of their own are. So there is a piece of work going on about this whole issue across the council. So I hope that's slightly reassuring to Kate about this is not something that's been forgotten, certainly not by me.
Thank you, Councillor Martin. It's really disappointing to hear the report from Councillor Salmon there, because we did look at this specifically when we looked at it a year ago. We did look at the mechanisms that were available to people that weren't using online systems, and they were in place. So to hear that feedback from a resident is a bit, well, it is very disappointing. Anyway, Councillor Beasley, thank you.
Thank you very much indeed, Chairman. I've got 4 questions or comments that I'd like to make, if I may, Chairman. But just following through from that last point, digital exclusion is something I've raised in many meetings, as members will know, and I'm very glad to hear that it is getting back up to the top of the agenda, which is where it needs to be. Like Councillor Martin, I represent a ward in Westbourne and Westcliff, which has a predominantly elderly population in parts of it. And as a council, we need to be accessible, and we need to be accessible to people however they are able to access our services. So really pleased and encouraged that that is now happening. So to my 4 points, the first one, looking at the information that's been provided in the report, and I'd like to pay tribute to the work that Stuart Walters and his team do. I'm in fairly constant touch with them, as you may imagine, and they are always helpful, and they almost always manage to produce results very quickly. But in terms of what's in the report around the current performance, it says it's averaging 14 weeks. So therefore, in some cases, it's going to be greater than 14 weeks. And that's the bit that really concerns me, because I had a case very recently that was at that upper limit. And although the average may be at 14, I would like to have the reassurance that that doesn't mean that those that are straightforward are way below 14, and that actually there's a cohort of applications that is some way above that, because that is where the problems arise and get reflected through ward members. And I would add on this one that we are now 5 years into transformation. Putting 3 services into one is obviously inherently problematic, but I don't know whether it's more problematic in this service than in most other services. I would kind of think it probably isn't. And I wondered whether I could have answers to those 2 first, please, Chairman.
Ashley?
Yes, thank you, Chair. In relation to the 14 weeks, what that refers to is that the applications that we are dealing with today were submitted approximately 14 weeks ago. It doesn't mean that we've spent 14 weeks working on them. It normally means that the pile is increasing. I think I said earlier that it's about 950 applications coming in every month, but only 850 are being determined. So there is a risk that there's some applications that are complicated, and that might be where we're having to ask for more information, and the information we're getting back isn't sufficient. And obviously, then we're in a dialogue with the applicant. But most applications can be done relatively quickly if the evidence and the application is all as it should be. But it just takes around that time to get to that application. So that is a part of the challenge we face. Your second question, sorry, Councillor Beasley.
It was around transformation, 3 services into one.
Oh, I don't think that's really an issue in relation to this service, because the service is essentially a government dictated service. So it's not that we had lots of different ways of doing it particularly. There would have been probably slight variations across a few of the councils, but generally I think everybody is following a similar process. I wouldn't say this was one of those particular sticking points.
That is what I'd assume, Chairman, and it's obviously more around resources or resourcing the service than the transformation process itself. Secondly, Chairman, the proposed flowchart proposed process flowchart will be of enormous benefit to those applying for the service, and also be of great benefit to members, I would imagine, so that we better understand how that works. Could you give us some idea of when that may be ready, please?
Yeah, so I kind of touched on the conversation we're having with our web team over the screen readers. So what I imagine is the solution is to have a flowchart and to have information that could be applicable to a screen reader. So you've got both, because sometimes just using the words doesn't give you the visual clarity of the process that the team are going under. So we weren't meant to be at the top of the web redesign timetable until around now. I think it was in the report, it refers to around October, November. So we are in that conversation at the moment. So I would say it's probably gonna take a month or so just to go through that process. But I think maybe the answer is something where we try and do both, so we don't sacrifice what works for lots of people, but we maybe have both things on the web at the same time.
Mr. Chairman, my third one is around what is dictated by government, and in two particular areas, but I know there are lots of others as well. So the first one is around those people with lifelong conditions and the evidence proof process, and avoiding repetition where it's clear that it's going to come out with the same result, however many questions are asked. I'm wondering on that one, as well as this issue of the £10 fee, which is woefully inadequate, because if we're talking about full cost recovery, which I think is quite legitimate in this case, I don't in all cases, but this case I certainly do, then we're way behind what is realistic. So in both of those areas, I think representations from our MPs really important, and if we can manage to combine those across the BCP geography, that would be good. And I'm also wondering whether this is something that perhaps could be taken up universally through the LGA as well, because if it applies here, it's quite likely it applies across the whole of England. I appreciate that the fees are different for Scotland and no fee in Wales, but I think for English authorities, which is the majority, the LGA must be able to come to some kind of discussion with government to push this forward. So a combination of MPs and the LGA has got to be part of the solution, I think. And I think it would be helpful also in that context, Chairman, if authorities were making those representations, if you like, funneled through so that they all end up in the same place. And that could be encouraged across the country, I have no doubt. No good if it goes all over the place, because it will not have the same impact and prioritisation. I think my last one is to ask a little bit about the applications that get refused, because I think there are no doubt issues with some applications which are tenuous at best. They may in fact be worse than that, but there are also going to be, I know there are in 2024 839 refusals, and I wondered whether, first of all, you can give us some indication of that 839, were they very much around not understanding the process, or were they something worse than that? And obviously time then gets expended on those to the detriment of the other applications, because you're using just the same people. I'm assuming they pay the fee up front, so they lose the fee. No, that's what I feared. So we're working for them for free, and it's occupying probably a disproportionate amount of time per application in some cases. And I also wondered, within that context, what sanctions are available, no doubt again prescribed by central government, for applications that can be considered fraudulent.
Okay, so quite a few points there, Matty. I'll leave it with you.
Yeah, thank you, Chair. In terms of refusals, it's important to stress they're relatively low numbers compared to the overall applications. And I think it's important also to stress that in many cases that they will be genuine applications, but they just might not meet the eligibility criteria. It's really kind of a critical issue here, is that a diagnosis in itself doesn't result in eligibility for a blue badge. There's all sorts of other assessments around how it's impacting on somebody's mobility. So sometimes the applicant may genuinely think that they would be eligible, but they're not, and then therefore it may be refused. I'm going to ask Stu whether he's got any additional detail in relation to the refusals, because he's obviously closer to it. Stu, are you able to put any pressure on that one?
No, I'm afraid I don't have any actual analysis to hand. The one thing I would say is that with those refusals, there is the ability for the applicant to appeal. And we do receive appeals, and as they come in, they are either looked at by another member of the team, or in some instances where we are maybe wavering, we will refer them for a mobility assessment carried out by an occupational therapist within adult social care. But I will have a look at the analysis of the reasons for rejection.
Thank you. Councillor Martin?
Thank you. Just very briefly, just wanted to pick up a couple of things that Councillor Beasley mentioned. So thank you for your acknowledgement about the accessibility. It's really important that we work on that. I'm interested to hear Matty say that any issues with the blue badge system is not a result of LGR. Maybe one of the few areas that's not a result of LGR. But you know, clearly we have resource issues, don't we, across the whole of the council. Everything is stretched, and I know I mentioned that earlier on, but it's worth reiterating just how stretched our finances are for reasons that everybody knows. I'm not going to rehearse them here. So you know, customer services is no exception, and we are constantly looking at where savings can be made, and you know, customer services is not excluded from that, but that clearly has a knock-on effect. And the last point I would make is that relating to the MPs, the honourable member for Mid Dorset has already offered to take this cause up. So I think we've got someone who will lead on this, hopefully in Parliament, perhaps with the support of the right honourable member for Christchurch and the 3 new Labour MPs across Bournemouth and Poole. So I think that's quite important to get that underway as well. Thank you, Chair.
Thank you. Have you finished, Councillor Beasley?
Yes, thank you very much, Chair.
Okay, thank you. Councillor Aikenhead.
Yes, I just noting the explanations you gave around after COVID there being an increase of and I really wanted to ask, does that mean that after that there was a bit of a decrease and that now we're in a cycle where each year is not equal? If so, does that mean it will go down? And also, if so, do we have any plans for 2027 when it might suddenly increase again because all the people renewing now will be renewing again?
I think it's an interesting point, and yeah, probably in simple terms, yes, it would create a distortion in the flow of applications. Although, perhaps understandably over a period of time, given the age profile of those using blue badges, that will change. And probably diminish over time. But initially, yes, it probably did distort it. Had we kept that that kind of simpler verification process for renewals going over it, then that would have probably worked quite neatly. But obviously doing it once and then not being able to keep doing it, that's kind of that's kind of disrupted that flow. So yes, I think the answer is in relation to predicting. We need to do more with the data and insight into the data flows. Obviously, we're getting new applications all the time as well, and that kind of it comes into the mix. But no, the point you make is a good one, and we need to think about what will happen in 3 years' time.
Thank you. Councillor Walters, thank you.
Just a few questions about the process itself. So once someone's got the application approved, do we send them an automated email from BCP saying it's been approved?
Yeah, actually, Councillor Beasley touched on the issue of payment, and it relates to this really. Once we've decided somebody is eligible, we then contact them and ask for payment at that point. And one of the reasons for that is because if we ask for payment up front, all those people that we end up declining, we have to then refund, and it obviously gets complicated and so on. So yeah, the final point is, yes, you're eligible. Ask for the money comes in, and then we issue we print out the blue badge and send it out. That's the end of the process.
Okay. The reason I ask is if at the point of payment, perhaps we could send out an automated email with a file or a bit of HTML code that said, click here to add a reminder to your calendar. That's something we could just automatically put as part of the email. Then they could just automatically have in their calendar for 8.5 months' time to start the application process again. I think that might be a way of getting around the issue you're having with between now and the 2025 with not being able to give people reminders.
I think it's an interesting idea. I'm sure Stu will be taking a note of it and to see whether that is possible within the process we follow. But no, it's something we certainly could look at. Yeah.
And then once someone has applied, is there anywhere they can log into in a kind of a BCP portal to see prior applications and the data that they put into it, or is that on the YouGov website or the .gov website?
So an applicant looking at their own previous application in terms of the evidence they presented and so on. I'm going to have to ask Stu whether that is a feature of the current system. Stu, do you know?
No, unfortunately, it's not. You're not able to track your application or look at your previous ones. I think, as I believe the plan, excuse me, is as transformation moves forward, Blue Badge and Microsoft Dynamics, and as we move into the single account, then that will come on board. I'm not sure on the timeline for that at the moment, though.
Because the reason I ask is presumably we could automate a process in which as soon as we get the approved application, we can automatically add that to some kind of portal in the new system so that next time they come to apply, they can just download their previous one, copy and paste all the information and shove it into the new application.
Well, certainly, if the evidence that's required is evidence that it is valid over time, then that certainly could be an option. In some cases, you might find some of it is and some of it isn't. But that would be the idea. I think, as Stu mentions, really using a system that's a little bit more designed for our own kind of requirements. Hopefully, then we get reuse of relevant information, and people aren't have to search for the same information every 3 years, and the difficulties that some people will experience in doing so.
And some of the emails I've received have been about response rates on inquiries around the process. And I'm sure you get lots of people emailing in just asking questions about how do I do this? And quite often you're probably just regurgitating policy back to them in those emails. Do we track any kind of KPIs for how quickly we get responses to people in those instances? Because I'm conscious that might slow down the process with which they start the application.
Right, I'm going to ask you to come in on that, because I think you're talking about people that are in the application process, but maybe experiencing, having a few questions about their application.
Yeah, they're all sometimes before they start the application process, maybe they just want a little bit of information, a little bit of extra support on how to do certain things.
Yeah.
And they might send an email across to the team.
Yeah, and it's important to recognise the assessment team are those that are literally working through that pile of applications that are coming in. On top of that, people will also ring for advice or support, and they'll go through to members of the team that don't do the assessment but are available to help and support them. I guess in some cases they'll move between the two if the application is live and an assessment is taking place. Stu, have you got anything to add to that?
Only that we have no way of actually tracking email specific contact at the moment. It's something that we're looking at the moment as part of the wider transformation piece. So we're looking at how we can route email through our telephony system, which will then eventually link into Microsoft Dynamics as well. So we'll be able to track conversations and contacts into single accounts for individual customers. And those customers will also then, as I said earlier, be able to sign into their account and see that they spoke to us 2 days ago and this was the response, or they emailed us and that would be the response. Unfortunately, we're not there at the moment.
Just final question. As part of that process, are we going to add in any kind of automation on the responses to those tickets or emails where, let's say, for example, so you get the same question, every day from lots and lots of different people. Is there any way to, find some kind of ChatGPT light-based solution in which you've shoved in all the government policies so that when someone does email in, they get an automatic response instantaneously with the correct information about the process? I think that might prevent people from going over the point at which the renewal, gets delayed and then they have to wait those 12 weeks. If we can get responses to those things faster in the front end, it might prevent people, having a few weeks here and there where they actually don't have the badge, maybe above that 3-month, non-compliance thing that you mentioned earlier where you don't enforce it.
No, it's definitely where we would like to be, and our new telephony system has what we call the omni-channel opportunities through chatbots and all sorts of things that we would like to exploit more, whereby the system can find the information. We can have up-to-date information in response to different kinds of ways in which customers might contact us in the future. At the moment, it's somewhat simplistic. People either phone, write, email, or go through the online system. But some of those other channels are not yet enacted. But we kind of hope that with those channels and with there's an opportunity to really make that work a little bit better, particularly for those that are more digitally enabled. As we said earlier, not everybody will work, will want to do that, but it's always part of our strategy for customer services and the digital sort of opportunities that we wish to pursue. That the more people that can and want to do things digitally, the more time we have available then to look after those that don't, and they then call us. So absolutely, the sorts of things you're talking about was where we want to be, but at the moment we're just trying to get the basics right, really.
Thank you. Sorry for taking the meeting down a very technical route.
Macro, thank you.
Thank you, Chair. Issue that I had with a resident was that they were actually put off for applying. They did feel that they reached the criteria, the eligibility criteria. I actually telephoned to clarify something, and it was regarding they were entitled to PIP. So unfortunately then the reason why they were put off was because they were due for an assessment. So by the time had they applied for their blue badge, that would have crossed over the assessment. So then they wouldn't have been may not have been entitled to it. So they've gone 6 months or so with the need of a blue badge. However, like I say, they've been put off because when it comes to the renewal, so as soon as they get that renewal, they'll probably get in contact with me and say, I've got my renewal for my PIP, so can I reapply? So just to bring that to your attention, yeah.
Okay. Yeah, just in response to that, I think you're touching on the kind of the variety of kind of situations customers can be in. We've talked probably more generically about those that have them for 3 years, which is the majority, but we have people that have them for shorter periods of time according to their particular circumstances. And I think, I'm sure she will correct if I'm wrong, but around those with PIP, there are slightly different circumstances that can apply, and people could find themselves having expired that before they get them. That's probably one of the unfortunate drawbacks of the system.
Councillor Waite.
Thank you. My question is about audits view on this. So when we went from undertaking minimal eligibility checks for renewals on the basis that these customers have gone through verification time for, then recommendations from audit in 2022, I haven't seen it in detail, but it just, as an ignorant person, it would just sort of appear to me that, a minor breach of an independent audit recommendation may be more forgivable than reaching 12-week timescales. So, is that up for reconsideration, or can we renegotiate it with audit? I mean, how does this work? I'm sure, but I mean, surely audit don't want us to be going up to 14 weeks. So could we not go, well, look, in these whatever chunk of the most obvious cases, can we not do some minimal eligibility checks on that chunk just to get through this year and potentially 3 years time as well, where we have this kind of bulge in applications?
First of all, I would say audit wouldn't. I'm sure would like to see us, improve our performance just as much as we would like to see it. But I think their role in relation to doing an audit review is to measure our work against the required standards. So, and unfortunately, unless we change the national approach to these things, the checking of eligibility is an absolute requirement. And whilst we did choose to adopt a sort of discretionary approach at a time when we thought that was the right thing to do, I think that the view was, once that initial moment had ended, we should and must return to the usual system, and that the best way of overcoming the issue is, as Councillor Martin's referred to, trying to change the way we the way we're meant to do it, not to go against the process. Although I totally sympathise that you either do that or you don't hit the 12 weeks, and neither of these things seem to be ideal positions to be in. Yeah.
Thank you, members. I think everyone's had an opportunity to speak now. Oh, sorry.
I just wanted to make a point and pick up what Councillor Martin said about the system. Strikes me, I hope you, as slightly primitive. We've got a system, and I'm just thinking whether you had a view on what ought to happen in the future, in the sense that at the moment when we apply for a license, I mean, my license now, I'm of a certain age, is only for 4 years. Or we apply for insurance, we have to give information concerning our well-being and our how fit we are and whether we're fit to drive. And it just strikes me for future reference that this is something that, if this is a national situation, that really it should be handed over to DVLA, or in, not necessarily that I want it privatised, but to our insurance companies, because as soon, if your car's not insured, for example, and the police pick up your lack of insurance, your car is taken away, and that's it's gone. And I'm not suggesting that there mustn't be discussions around how it happens, because I can see people shaking their head. It's just that at the moment we're in a local situation trying to sort out a national problem, and I don't fully understand why something hasn't been done about it years ago. Anyway, I'll leave that with you. Thank you.
Did anybody want to come back on that, Councillor Martin?
Only to just refer back to the quote that I read out for my resident, who is blind, and it doesn't make any sense to us that the system doesn't allow, doesn't have any wiggle room for people like that, or most of the other cases that I've been dealing with recently. So I completely agree with what you say, and we need to work harder to try and change the system nationally. I must admit, having only come to this issue in the last few months, I simply don't understand why the system is as it is. But I'm sure we can say that about many things in public services. But I completely agree with your point.
Okay, thank you, members. There's been an interesting debate, and there are a few things I'd like to just mention. The first, I think, is to put this thing in context about the numbers of people that do actually apply and hold blue badges. And it's about 5% of the population. When you look at the numbers, it's huge number. Over 21,000 people with a blue badge. The second thing is the huge benefits of holding a blue badge. The economic benefit is also significant, and this is probably why the system is as demanding as it is. And the rules have been developed over many years by government in order to prevent fraud, and I suspect that's why it's such a critically, it's a very difficult system. I think Councillor BC made some points that I was going to mention, and one in particular was the fact that the average is 14 weeks. I hate to think what it might be in the worst instance, and there will be people out there waiting longer than 14 weeks. And it is a bit disappointing, I have to say, having seen where we were, and I think Councillor Trent mentioned it, that we've now opened the box and we've looked at it, and it's actually gone in the other direction. And I was interested, and I understand that the answers that have been given in the report for this, or explanations for that. But I was very interested about the 11% increase in new applications, because I don't think between last year and this year we're all living 11% longer, which is one of the explanations for it. But that is a huge increase. And I just wonder what has caused that. That seems to be a very different, 11% increase in new applications. There must be a reason for it, and I can't think of one over that year. I think in terms of the flow charts, I think that recommendation has been misunderstood. What we were talking about were flow charts that would help our organisation structure itself or understand what was happening in order to contribute to the transformation program and how it would be then integrated within the new system sort of being implemented. The benefits for new staff, for training, for example, any service that we provide should have some form of documentation to show internally what that process is, and in terms of service delivery. And so I think that the thought was that there wasn't one there. The only people that understood really what was going on were people actually managing the service. And my goodness, if one of them goes off sick, that can cause a problem. And I think to a degree, maybe some of the issues we've got are because the manager or the expert in the area was not available for whatever reason for quite some time. That definitely would not have helped. But of course, if you've got a process that's documented and someone can pick it up, it's obviously a bit easier to do. But I think it's talking about the future and dependency. We do have an expectation we have from the transformation program, particularly for these kinds of services. Because I think when we started out on the transformation program, we had visions of integrating all this data. It's one of the main aims, isn't it, that we can look, have all this data linked into residents or a contact database that we can see this information and we can use it to produce something more efficiently. So the last point I'd like to make is on the cost. We are currently, it's costing us about 100 grand a year more than we got coming in order to deliver the service, which is a significant bill picked up by the council taxpayer. And that's why we raised it a year ago, because we felt that the fee was very, very low. And that's why, and I think Councillor Beasley touched on this, about the funnel of opinion and how we can channel that back. And that's why we mentioned the LGA in our report. And I think the idea of bringing MPs on board to help put some influence to this is a really good thought. Which brings me to the next point, is what do we want to do now? Because we've discussed that we know the problems, we've got continuing problems, we've got some ideas of the things that are going to help to improve it, but what can we as a committee now do to try to progress this? And should we bring it back to committee again in the future, or should we be encouraging chief executive to write to our MPs or try to corral the LGA in some way? Let's not waste this work that we've done. Let's see if we can get something useful from it. Councillor Trent wants to come in on this.
Well, I think based on what the discussion's been about, I think we should perhaps back a representation made by whoever's the most effective person to make these representations, but we can sort of back it up that the fee does not cover the costs by any stretch of the imagination, and that a fee that more realistically covers the costs should be sought, and that we should also seek a simplifying of the system that makes renewal easier, rather than treat each renewal as a new application. I think if renewal was made easier, that would save a lot of time and would sort of speed things up for everyone else. So I think those are the two key things that came out. And then internally, just to make sure that we have enough people available that can sort of move in when there is, as was the case a couple of months ago, long-term sickness, that we can build that into the system, that we have some multidisciplinary trained people that are able to backfill these positions. I think that's basically what came out of it, but I probably missed a few points.
Yeah, okay. Well, I'm asking Claire to get careful note of this, because I bring you back to the recommendations in the report. One is to the progress update on the previously agreed actions are noted. I think we can probably note that. The update on the current blue badge processing performance is noted when we've had the update. And no one has provided any further comment. Well, we'll take a note of these comments and we'll list them and we'll put them in the minutes of this meeting. Sorry, there was Councillor Devlin wanted to come in. Yeah, thank you.
Well, thank you, Chairman. I think it's rather like Councillor Trent was saying, that it would be a good idea for this committee to ask the portfolio holder to take this further, because I think all around the table we've been saying this is a central government issue and we're trying to do it locally. And there was a mention of some of the MPs, some of which are new. Is it possible that this committee could recommend that to take it? I mean, I think Councillor Beasley mentioned local government organisation to put the point from the council or this committee that it is an issue, and it must be shared obviously by other councils, I think.
Absolutely. I think this committee can recommend to whoever we wish to make a recommendation to. It could be to the leader, chief executive, could be the portfolio holder. Councillor Beasley.
Thank you, Chairman. In addition to the LGA, though, my suggestion of local authorities writing in to DFT, I think is something that should be seriously thought about, because the response from government will be that there hasn't been the weight of representation from local authorities to warrant actually changing the legislation. If there has been a consistent and large number of representations from local authorities, say over the next 3 or 4 months, or even longer, as a result of the LGA getting involved, then it's my belief that that it will then be prioritised. Without that, I think it will be kicked off into the long grass, whatever our MPs do.
Could I just ask the Chief Executive, thanks for being here this evening, is this the DFT, is that something that would be better coming from you or the portfolio holder?
Happy to do it either way. The best practices that we've had are probably both. So if I write to the lead civil servant and the portfolio holder or leader writes to the minister, I do think it's worth doing. I don't hold out a great deal of hope though, because we've been talking about parking fines for probably about 3 years. And there are many, particularly regulatory fees, where the fee is nowhere near covering the cost of providing the service. And those are fees that are enshrined in statute. But I actually think it's worth writing. What we would normally do is raise the issue that way, copy in the LGA. I could talk to the regional representative. They'll find out if there's a local group within the LGA that's pushing that as well, and see what support we can get. So we can do both those.
Okay. Would it be all right then if we as a committee do agree a recommendation that we ask both the chief executive and the portfolio holder to write to their appropriate people in government to raise the concerns that we have listed here at this meeting this evening, or words to that effect?
I'd just like to just put one caveat that I think we need to think about. I do think it's absolutely right that we should be asking government to give us the freedom to raise fees where we need to. But I think that before we do that, we need to think very carefully that we're not putting anyone off, because although if you were to raise it quite a lot all in one go, even though it doesn't sound like very much to us, to some of those people who are on the PIPs and are not working, maybe it may seem like quite enough to them that it might put them off applying. So just really wanted to caveat it with that I completely agree with us having the power to do it, but I think that we should use that power carefully.
Okay. The other thing I'd like to just suggest is that we do bring it back to committee, particularly to look at the work that's being done with the transformation programme and see, how this system is going to be integrated within the transformation programme. I don't know if 6 months is too early. Is that too early, Matty? Do you think, or should it be a bit longer?
Well, we are hoping that well, there will be a process to move on to dynamics, and that's the moment I think you're referring to in relation to how we can make the whole thing work more smoothly, picking up some of the opportunities that might bring. So happy to come back in 6 months if that would help.
Everyone happy with that? Yep. Okay. Thank you. Councillor Waters.
I was just going to add to that, going after what Sue said there and the impact on some of the poorer people who are going to be applying for this. Is it worth including into that email a request for auto approval for people with lifelong conditions? Because then that way we're spending less money at sorting out the process and approving all of these different ones. And we're not actually asking for any more money from the people applying in that situation. So it's a cost cutting measure rather than a expense increasing for those applying.
All I would say is I think we would need officers to think about that, because there may, you know what I mean, there may be reasons, very good reasons why that's not being done now, and we haven't discussed them. So I think we could ask officers to you know, to look at that, and if they think that could help, that they would include that in any representations that they make. I'm always very wary of, you know, unintended consequences. But you've come up with some really good ideas, actually, Councillor Walters, about, you know, about some of the things that we might be able to include, particularly, and a lot of that is the key, is the technology that we're introducing. It really is. So, okay, is anybody else got anything more? Councillor.
I was just going to add that it occurs to me that the leader and the portfolio holder for housing and regulatory services are at the LGA conference. So I think I will try and get hold of the both of them and do some work up there. Well, not them not doing any work, but, you know, do some more work.
Yeah, okay. All right, thank you. Well, I think it's a really good debate, and let's hope we can make some progress on this, and good luck with trying to shorten those waiting times. So we'll close this debate now. We'll move on to the next item on the agenda, which is the work plan. Right, let me just find it. Has everybody read the work plan? Does anybody got any issues that they'd like to raise on it before I start going through it? Okay, we'll just quickly go through this then. Our meeting for the 18th of November, the Q2 budget monitoring report, which we mentioned earlier on. Oh yeah, the effectiveness of public consultations, which answers Councillor Macklow's email that you sent me earlier on about what are we doing about public consultations. We've had a preliminary meeting with some officers to talk about the content of the report. And then we've got the budget working groups, and we've got dates offered for that. I think that process is now in train.
Yeah, just to say that will be all the budget working groups from all the different committees will be reporting back into ONS board.
Yeah.
Okay.
Yeah. Okay, 9th of December. Okay. I think I don't need to go through every item one by one. I think unless anybody's got any queries they'd like to raise on those. Okay, and then the 6th of January, transformation program closure report, which is interesting. I'm not sure, you know, I look forward to seeing that one. Another interesting item coming up is the Investment and Development Directorate Regeneration Programme. And again, we've had a preliminary meeting with the officer responsible for that area. And there was an action on me to give her a written brief, actually, for that report. And then we come to the 3rd of February, a budget scrutiny. Hopefully we'll all be fully au fait with what's in the budget by then, with all these working groups and recommendations that are going to be made. Okay, and there's a few things that without dates at the moment. Accounting for social value and decision making, which is an interesting one. It says it requires further scoping, and I think that was it Councillor Rice that raised that one. Yes. Do we have a key lines of inquiry document?
I mean, if anyone clicks through on the link on there, it should take us to the key lines of inquiry document, and anyone's welcome to add.
Oh, so it is there then, is it?
I think that works.
Looks like that one is there already. Okay.
Sure.
All right. Arts, culture and leisure funding. I remember it was I think it was Brisbane that actually raised that. Councillor Goodall, it was you that initiated that item. We've been talking about that a little bit, and I think we were a bit concerned that we were not being asked to do too much in one thing, because we tried to bring the leisure, you know, leisure centres into the, and I think your query was primarily about arts and culture, wasn't it? Yeah. So maybe we should be looking to split those out rather than bring them together. Would you be happy to do that?
Yeah.
Notwithstanding, we do need to understand the long-term future. Yeah. I mean, we do need to understand the long-term strategy for the leisure centres, but I think for the time being, I think we should focus on the arts and culture for that particular item. The next one, working more collectively. Well, we now know a bit more about the governance thing that we had a briefing on it from Chief Executive. I'm not sure it encompasses everything because I think we were looking about our local governments as opposed to, like parishes and town councils and not just what may happen in the future in a larger picture. I think we need a key lines of inquiry. Do you know who we're expecting that to come from, Claire, at all?
That was an issue raised by several people in our work planning processes. There were various different issues raised. So if anyone has anything that they wish to contribute, just let us know, and we can we probably need some initial meetings around that.
Okay.
But we can start the ball rolling.
Right. Transformation of the centralised handling complaints. I think we've had a discussion about that.
No, it's
Yeah.
on there twice.
Yeah, no, that's been scheduled with a date now, so that just needs to be removed from there.
Generation, performance of the council. That was something that I don't know if you remember. I did write to everybody, asked if they were interested in joining a sort of an informal working group about that. Best will in the world. I'm not going to go ahead and do this independently by myself, but if anybody would like to get involved in that, and this is the link from the directorates to the strategic plan and the strategic performance reports that we get, but it's to start looking a bit deeper into the directorates to look at the way performance is managed within the directorate. We might choose one directorate, or we might choose two, or just one particular area. It might be looking at staff performance, for example, or service delivery performance. But you couldn't possibly do it across the whole council, but it would be doing a sort of a deeper dive to see if there are any issues that might actually be applicable across the council. So if anybody thinks that they would like to look at that, then please let me know. But we'll leave it on there for the time being. Public consultations working group. Where did that one come from?
That's next.
That's the next one.
In the next meeting.
Next
meeting.
Yeah, so it's a suggestion for a potential working group.
Okay, all right. And then there is one that's not on there at the moment. I touched on it earlier on, and that was the potential for a working group to look at what was it we were going to look at? The customer services area reporting, customer service reporting. Now, I'm aware CRM is transitioning to the through the transformation program. Perhaps I can ask you, Matty, is it the right time to be looking at it now, or would you think we should delay it? But what I am very aware of is that there's a lot of comments being made from various members about residents complaining about their engagement with the council, particularly through customer services. And I know it was discussed at audit and governance this week. If that is something, we'd be wasting our time, given the state of change on the transformation of the CRM development in particular. I'd be interested to hear your view on it. But we would, I think there is an appetite for members to actually form a working group to start looking into this, to put some quantification to it, rather than anecdotal stuff that we're getting at the moment. And of course, it does also link in with the customer complaints piece of work that we're going to look at. Anything? Would you like to come back on that, Matty, at all?
No, I think there's no bad time to look at it. I mean, I think it's quite useful to have left it until now, because we've had a new telephony system installed, and it's taken a while to be able to get reporting out of that new system, although the system is a much better system than the one we had before. So, but that's just from a telephony point of view. What we would like to be able to discuss and report to you is performance across the different channels. We talked about some that we haven't yet launched, but there are still existing channels which we don't often talk about, such as the email traffic we get as well, and the report it functionality within the website. So, happy to to participate in a piece of work that you want to do across that whole piece. And as I say, there's no probably bad time to do it. There's just we're on a continuous process of transformation and change, really.
Well, so in principle, members, can I ask you, would you be in favour of a working group for that? How that is constituted would be as a different question, but in principle, if you want to do it, and can I ask if anybody is interested enough to being part of it? Okay, that's lovely.
Can I just
yes?
Comment?
Yeah, of course.
We've got on here next meeting, reduction and effectiveness of public consultations. We've got the possibility. We need to have sometime on a future date, we need to have the report back of the working group on the public consultations. And at that stage, it would be perhaps a good time to start the next working group.
Okay, yeah, point taken. I'm aware we need to prioritise these. I think members, you can leave that with me and the vice chair to work out when we might be able to schedule that and come up with a suggestion for that. So lastly, we've got some presentations coming up. One is the ERP system demonstration on 13th of November. We've got the bid presentations. I think that's coming. Is it in December? Do we have a date for that yet?
Yeah, I think we're looking at the first week of December, but I'm still consulting with some of the bids to agree a date for that.
Okay. We've also got integration of the Dorset local enterprise function into the council. I can't remember where that one has come from, to be honest.
Was a request received a little while ago, but it's not for some time. It's in there for January 2026. So it's just waiting there. It says January 2026. Should that be 2025?
But that's due to close by March next year.
Okay.
So it should be 25.
Yeah.
Okay.
Not a lot.
Thank you.
The following year. Yeah.
Okay, I think we need probably to look at a little closer at that one. So, members, any more on the forward plan from anybody? No. Oh, yes.
Yeah, thanks. I just wanted to ask. So I've got a couple of new potential subjects that I want to put in, so I can fill in the request form. But I think I am a little hazy on the process around. You fill in a request, the request for scrutiny, and then there's the key lines inquiry. Do I do that at the same time? No. So I send that, and then I wait, and then I get told to fill in the key lines inquiry.
Yeah. So if you fill in the request forms, we'll take those to the next available meeting, and we'll consider it as part of this process.
Okay.
So if you can provide a bit of information on there, it's really helpful then for the committee to make a decision on it. But then we don't need to go into lots of detail until those have then been agreed, and that's at the point where we'd complete the key lines of inquiry.
Okay. Thank you.
Okay, members, thank you very much. Meeting closed.